today we're going to go over a neonatal neurologic exam. And before we break it down into the components of the neurologic exam, there are a few things I wanted to say in overview. So one thing that's imperative to know when you're doing a neurologic exam for a neonate is the gestational age. So certainly a full-term infant, like this one here, is going to have a very different neurologic exam than what you would expect in a preterm baby. So the first thing you need to know is the number of weeks gestation, whether the baby's full-term or not, to know what is normal and abnormal in your neurologic exam. The second thing to note that's very important in a neonatal neurologic exam is that their exam is extremely state-dependent. So if they are awake, if they are asleep, if they're in something called active sleep, those will all greatly influence their neurologic exam. And for example, a baby who's just had a big meal will be almost very difficult to arouse because they're so sleepy. And so sometimes when I find myself in that situation, I'll come back and try and examine the baby later on, or ask the nurse what his or her most awake state is like. Okay, so those are two things we really want to know about. First of all is the gestational age, and for this little guy, he's full term. And then the sort of mental status the baby is in. And I think this little guy is in sleep, maybe a little bit of active sleep right now. Okay. And then one final point is that we don't take one piece of the neurologic exam by itself, but we use all the components of our neurologic exam and put it together to try and really understand the neurologic state. Okay, so one reflex by itself, one tone finding by itself, we need to put it all in context. Okay, so now when we talk about the different components of a neurologic exam, starting sort of from head to toe, the first part we want to talk about is the mental status. Okay, so to get your baby awake and alert, we're going to just kind of lightly put our hand on his or her abdomen and chest and just kind of lightly, soothingly shaking the baby a little bit, and maybe moving the arms and legs a little bit, putting the head midline. Hey. Hey, little guy. No. Sleepy, huh? Okay. So I'm just lightly stimulating him, and he's opening his eyes up now. Look, and you can see how his tone has changed. So at rest, a full-term baby's tone will be kind of legs up a little bit like this, arms up a little bit like this. Okay, and as I've gotten him a little more awake, he's moving his extremities quite a bit and opening his eyes just a little bit as well. Okay. All right, so now that I've got you awake, so his mental status right now, he's awake and he's alert and he's not upset. Okay. For cranial nerves, which is the second part of the neurologic exam, I'm looking at his eye movements, and I can turn his head a little bit from side to side like this, and I can get a doll's eye reflex so that his eyes stay midline as I turn his head, and that way I can tell that cranial nerves 3, 4, and 6 are all working. For cranial nerve 2, that's looking at his pupils. And turn your head here and lightly hold his eye open. And there we go. Oh, sorry, kiddo. So that's cranial nerves 2, 3, 4, and 6. For cranial nerve 5, sensation on the face, I can check a rooting reflex, put my hand next to his mouth, and see if he responds. See his tongue, his mouth opens, his tongue kind of comes out. So that's cranial nerve 12. Okay. And another way we can check cranial nerve 11 is if we can get him to turn his head to the rooting reflex. There we go. Nice turn that way. Okay, buddy? And how about this one here? Okay. There we go. Okay, so that's cranial nerve 11 and 12. Another way to check cranial nerves 5, 9, 10, and 12 is to check his sucking reflex. So if you put your pinky into his mouth, you should get a nice suck. He's latching and he's bringing his tongue up. Yeah. And that's a great test of cranial nerves as well. You can check a gag reflex if you insert your finger in just a little bit more to the back of the soft palate. Oh boy, and then we get a little gag. Okay, cough. And that means he's protecting his airway with his cranial nerve, his 9th cranial nerve. Okay, buddy, let's get your head midline again. Okay, so now we've done the mental status exam, we've done the different cranial nerves, and then let's move on to tone, which we had talked about a little bit. So right now he's quite relaxed, but his legs are a little bit flexed. Oh, and you can see once he gets a little activated, he brings his hands in quite well. Okay, all right. So it's important for us to talk about resting and active tone because resting tone can be quite floppy, and when he gets awake, he might have quite good activated tone. The other thing we want to talk about is central versus peripheral, or axial versus appendicular tone. When we're talking about appendicular tone, we're looking at his arms and legs. Okay, so you kind of gently want to move his arms for range of motion and kind of look at how much passive stretch his muscles have to stimulation. And he's got quite normal appendicular tone. Yeah. One word of caution when you're checking the tone is you want to keep his head midline. Having his head to one side can actually give you asymmetric tone with increased tone on the side that his head is on. Okay, so let's keep his head midline while we're checking his tone. Okay, now let's talk about his central tone. That means his trunk, his neck, sort of the midline, his hips, that kind of tone. So one thing we can do is gently lift him up. Hey, buddy. And see if he can bring his head up. I'm supporting his neck right here, but I'm going to see if he can bring it up himself as well. There we go. And can he hold it up briefly at 90? And he can. All right, buddy. Another way to do it is to grab both of his arms and lift. You going to do it? Yeah? Okay. Two other tests for central tone. One is called vertical suspension. I put my hands underneath his shoulders and lift him up this way, okay? And I'm looking to see how much he can support himself with his shoulders to not slip through my fingers. Oh, buddy. Okay, you're okay. Okay. And then the other way to test for central tone is called horizontal suspension. And we do that, hi kiddo, by turning him on his stomach and holding him and seeing if he can bring his head up to about in line with the rest of his torso. All right, so we talked about then central tone and appendicular tone. We talked about resting tone and active tone. Now, when we talk about strength testing in a baby, we are also going to talk about sort of central strength and peripheral strength. Babies, of course, can't follow commands, so you can't say push or pull to a baby. So the way that you can check for strength is evaluating whether you can get them to hold their arms and legs anti-gravity, which certainly he can do. So that's at least a strength of 2. And also how much he resists when you're trying to straighten his leg. That's pretty good. That would be probably a 4 in strength there. Now let's move on to talking about the sensory exam. So again, a baby can't tell you whether they can feel something normally or not, but certainly they can respond to light touches. So if I just lightly tickle this leg and see if he activates in response to that, and in fact he might even move away from my tickle, that would be a sign of localization to stimuli. Okay, yeah. Okay. And you see him bringing his arm up to the stimulation here. Okay, great. In a baby who's really not responsive, in order to get a good sensory exam, you may have to do more than tickle. You may have to apply a little bit of pressure, nail bed pressure, or a little bit of a pinch of the skin to see if they'll respond to that. But in this case, he's quite responsive, so we don't need to do that. But in summary, the sensory exam would talk about responding to stimuli in all four extremities. Okay? All right, now let's move on to talking about the reflex exam. So in babies, we have two kinds of reflexes we talk about. The first is the deep tendon reflexes, just like we look at in adults. The second is what we call the primitive reflexes, reflexes that exist in babies, but as their nervous system matures, they no longer have those reflexes. So let's start with the deep tendon reflexes. So as you can see here, you need to have the right tool to check deep tendon reflexes. This one is an adult reflex hammer. As you can see, this is pediatric, and this is neonate. You really don't need to have a long pendulum swing to check a reflex in a baby. And you can have a bigger or smaller head based on how big their tendon is. You want to hit right on the tendon. Hey, bud. Yeah. Okay. So starting from the arms and going to the legs, the first tendon reflex we're going to be checking for is the C5 reflex. And in adults, we often do that by checking the bicep. So that would be right here, putting my hand right on that bicep tendon and striking my own finger and feeling the tendon jump, okay? And same thing on this side. Hey, bud. And seeing that tendon and feeling that tendon as you hit it. Now in a baby, sometimes they're very upset and their arms are scrunched or they've got an IV in there and you just can't check the bicep reflex right there. Well, another way to check in a baby is to check the pectoralis reflex. So the pectoralis muscle is also innervated by C5. So if you have a hard time getting the bicep, you can check the pectoralis. And that's where you look at sort of the line between the shoulder and the chest, put two fingers lightly over that space, and lightly hit that, and you should see the shoulder abduct inwards, and that would be a C5 pectoralis reflex, as you can see. Okay, buddy. Now, C7, the triceps reflex, is not always present in a neonate. I got one there, though, as you can see. And that one, I'm not going to put my finger on it because I really want to hit the tendon directly to get the best reflex I can. And that has him straightening his elbow. Okay, so those are the arm reflexes. Now let's do the legs. Hey, buddy. So I'm going to feel for the patellar, which is L5S1. In babies, the patellar is often much more lateral than you would expect. So I feel for the step off of the patellar, the kneecap, and right underneath that, and just a little lateral, I can feel that reflex. Yep. Let's make sure he's nice and relaxed in his leg. Sorry, buddy, so that we can get a good reflex. Okay. All right, bud. Make sure his leg is relaxed. There we go. Now we hit it. So it's just a little bit more lateral than I was expecting, and as you can see, he has a very brisk patellar reflex. Same thing on this side. There we go. And even got a little bit of clonus there, so as you can see, his foot wiggled a little bit. Now let's do our Achilles. We can do our Achilles by extremely dorsiflexing his foot and then hitting right on the finger. And you can see his foot kick down. Same thing on this side. Another way to do it would be to hit the Achilles tendon right on the tendon itself. Okay, all right. So those are the deep tendon reflexes. Another one we can do, check, is a cross-adductor reflex. So I'm hitting the abductor muscle on this side and seeing if I can get the other side to also adduct inward. So what you'll see is this adductor goes in and this one does as well. That's why it's a cross-adductor reflex. And I'm not seeing too much of one right now, and that's fine. This can be a sign in adults of increased reflexes in a baby, it may or may not be present. Okay. All right, now speaking of what we said earlier, clonus. Clonus is a sign of increased reflexes. Okay, so 0 would be getting no reflex at all. 1 is just a tiny bit. 2 is a reflex that can be against gravity or full. 3 would mean there's increased reflex such that you might have spread, where you hit one reflex and you get the reflex further down activated, or 3 can also mean clonus. So clonus is where if you put enough stretch on the tendon, you can get kind of the foot going up and down. And clonus can be normal in a baby as long as it's not sustained. Let's see if I can get it from doing the reflex again. The reason that I'm ranging his leg is because sometimes the clonus only appears at a certain stretch of his leg. And it doesn't matter at which point it appears, as long as it does appear, that can be a sign of increased reflexes. Okay, all right. So those are the deep tendon reflexes. Now let's go ahead and talk about the primitive reflexes that neonates have. So when we talked earlier about the need to keep his head midline, that's because of something that we call the asymmetric tonic neck reflex. And so that is that when a baby's head is to one side, they have a reflex where the arm on the opposite side flexes and the one on the side they're looking at straightens. Buddy. So we also call that the bow hunter's reflex because it looks like someone who's shooting and a bow. So if I have his head on this side, this arm is up and this arm would be straighten. And if I turn his head to the other side, you see this arm comes up and then this arm will have a tendency to straighten. Okay? Right there. Okay. Now another reflex we can check for is what we call the Moro reflex. That's where we take both hands, we can lift them up gently and let go. And as you see, his hands come out, they adduct and then they abduct, okay? And that's what we call the Moro. So what we're looking for is symmetry in both hands. Oops, you've got your head on the side, buddy. Okay. Opening and closing together. Okay, good. Another way to check a Moro is to put your hand underneath his neck, slowly lift his head up, and then drop it quickly. Sorry, my hand is in the way there. Oh, buddy. I think this guy's getting a little hungry. So some different techniques for soothing in the middle exam, shushing, and giving him something to suck on. Okay. Good. Let's see if I can do the Moro this way. There we go. That was a full Moro. Okay. Now just a few more primitive reflexes. A neonate will have hand grasps. You put your hand on the palm and they will grasp your finger. And this side too, little guy. And he's grasping onto my finger. Okay, and then, oh, I know, kiddo. And then also plantar grasps, putting my hand, oh, I think I'm activating. There we go. There's the plantar grasp, and over here as well. Putting your finger sort of at the intersection of his toes and the pad of his foot, he'll kind of clench down on your finger there. Okay, good. Then we have the step reflex. When we put his feet down, he may take a few steps there with his feet. Okay. Okay, and last one is what we call the gallant reflex. Okay, and this is looking at his truncal reflex. If you run your hand along this side of his back, his bottom will turn towards the side that you're running your hand down, as you can see. Okay, all right, bud. Okay, and this is a very healthy full-term neonate who's ready for a meal.